Welcome to the Confident Retirement Podcast. Is doing the most important things alone a good idea? How comfy are you with your choices when it comes to life's biggest decisions? What is real peace of mind with financial confidence, and how can you get it? Kris Flammang and Mark Peachy are the founders of LPF Advisors in Sarasota, Florida. On the show, they bring together the best and brightest minds to share with you how to have a more confident financial picture. They empower listeners with simple, common sense and financial wisdom. And now, here are your hosts from LPF Advisors.
I want to welcome everybody to the Confident Retirement Podcast brought to you by LPF Advisors. I'm your host here, as always, every week, Kris Flammang. And today I have the pleasure of welcoming David Silver on the podcast. He's been a Medicare coverage specialist serving clients primarily in Florida since 2007. It's been so long, he's earned the nickname Medicare David. Mr. Silver, thanks for being here and welcome to the show.
My pleasure. Thanks for having me, Kris.
Yeah, we're going to have a good time. So you have an interesting history. I know a little bit about your background. Take me through kind of a brief summary of how you got to where you are today.
Well, in my earlier career, I was in the food business, had some delis and bagel shops and things of that nature. Invested my profits into real estate, and back in 2007, the real estate market crashed, and so did my investments. Didn't want to get back into the business again, so I got my insurance license, and actually fell into the Medicare business by accident. I found an ad on Monster.com. I called up and they had mentioned stuff about great leads that we provide, great insurance product. Like, let me give it a try. I went and interviewed. It was a United Healthcare Medicare Advantage plan at the time, and trained about 4 or 5 months, got into it. After about a year, broke out on my own. And here I am today, all these years later. So it's been good. I enjoy the business. I focus completely on Medicare. I don't do any other type of insurance products. And it's worked out quite well.
Awesome. So if you could go back in time, all the way back to 2007 when you started and got involved, is there any advice that you would give your younger self? Something maybe you wish you knew then that you know now?
I always knew that my approach to sales has always been knowledge, like being able to answer all questions, not in sales speak, but having real answers. People have real questions. You want to have real answers. When I look back, I really wouldn't change anything outside the fact I wish I was better trained, because there's a lot of things that came up that I was given incorrect information on. So it was not until I was in this business, probably 2 or 3 years, maybe even 4 years, that it was a total learning curve. So there's so many nuances to Medicare. There's a lot of rules and regulations. You got big companies, big government, all combined. You have to be very careful what you do. Compliance is a major thing. And being able to answer the questions, just getting all that knowledge, it takes a long time. It's not something that you could just walk into, because you can really mess people up putting them in the wrong coverage just because you don't have all the answers, but you think you do. And everybody's in sales, everybody wants to make a sale, but knowledge is power. And that is, if I was going to give advice to somebody who's getting into the business, learn as much as possible before you hit the ground.
Yeah, there isn't really a replacement for that. And that kind of segues into the other question that I wanted to ask you. So you mentioned a couple things there, but are there some certain areas of helping clients that you find to be the most challenging?
The most challenging part is extracting the information out of them. Okay. Because the more accurate information I receive from my clients, the more that I'm able to help them. So I always tell people, the answers that you give me are going to dictate what your best options are, and not the other way around. So sometimes, like, for example, I'll sit with somebody and they'll tell me, I need a list of your medicines. I need a list of your doctors. Well, they'll give me a list of their medicines, but it'll be incomplete. They won't tell me about an expensive medicine that they take, or they won't tell me about a doctor who saved their life because he performed open heart surgery on them. So just getting the right information from the people, accurate information, is very, very helpful to me. And it ensures the fact that I will not make a mistake in terms of giving you your coverage options.
Yeah, the coverage that they need, the best match. Okay, so what do you think is a big misperception that you see people having with Medicare?
Just a lack of understanding. Now, there's been studies done by Kaiser that the information that people get is typically from friends and family. The people that care about them most, typically the most inaccurate information. Questions that I hear on a day-to-day basis are just not the way Medicare works. There is just a ton of misinformation. Some of that comes from agents like myself, not me in particular, but agents like myself who just don't know the business inside and out or know Medicare inside and out. A lot of it comes from friends and family who get bits and pieces of it right, but not the whole thing. So there's just a lot of misinformation about Medicare. So it's really important to speak to somebody who knows what they're doing. Like I was just at a lady's house the other day. Her mom just moved here from out of state, and her mom's going through cancer treatment. And, she's trying to find her mom and she's trying to put her mom into an Advantage plan because she had an Advantage plan from the state that she came from. She found out about me. She called me up on the phone, and based on the rules of Medicare, her mother was able to get into a Medicare supplement policy without any medical underwriting, which was a total godsend. But, if she didn't call me, she never would have known about it. And choosing another Medicare Advantage plan for her mom would have been very expensive, and it would not have been good. So, these are the things that it's always good if you have a good resource. Well, I don't care if it's financial planning, Medicare, carpentry, home improvement. If you have a good resource, it's really hard to find good people. And I like to, I take pride in the fact that I think I'm one of the good people when it comes to Medicare.
Okay, so let's jump in a little bit to some details on Medicare. I'm hoping you can kind of educate us and demystify this for everybody. Can you explain in really simple terms, first, what Medicare Part A and B are, and when people are either required or when do they have to enroll in those?
Well, Part A is typically, it's called hospitalization.
Okay.
So it's called, on the Medicare card, it says Part A hospital and Part B medical.
Mm-hmm.
So like Part A covers you for other things, besides hospitalization, but that's the main point. Part B covers you for other stuff, but going to the doctor, it covers is the big part of it. Okay. Now, Part A and B cover you for other things, and I should know what they are offhand, but that's one of the few things I have to Google for people. But for the most part, is Part A is hospitalization, Part B is medical. People typically enroll in Medicare when they're turning 65. Okay, that's when people generally get Medicare. Sometimes if you're on disability and you're under age 65, in your 25th month of getting disability, you're eligible for Medicare. So it's not an uncommon thing, but it doesn't happen all the time. Generally speaking, when people turn 65. Another time when, if people are still working and they work for a company of over 20 employees, sometimes it's in their best interest to only take Part A, opt out of Part B for the time being. And then when they're ready to retire, if they're not getting any type of group health insurance for retirees, I always advise people 3 or 4 months before they're ready to retire, they should go and apply for Part B. There's paperwork that has to be submitted to their employer, and they have to fill out paperwork, and that paperwork has to get submitted to Social Security. And you can get your Part B started whenever you want, and there's no late enrollment penalties. Typically, those are typically the 3 times. If you're on disability, under age 65, 25th month of disability, you're eligible for Medicare. When you turn 65, you're eligible for Medicare. And if you work for a large company of more than 20 employees and you have group health insurance benefits, sometimes it's in people's best options to delay Part B until they're ready to retire and lose that group insurance benefit.
Okay, now on that last part where they're still working, right, and they forego Part B because they have the employer coverage, do they still have to do something to enroll in Part A when they're 65?
They can go online and just apply for Part A. They really, if they don't want to do anything, they don't have to. I always advise people, it's easier to apply for Part A now, even if you're going to retire 5 years down the road. Mm-hmm. Just get Part A now and get Part B, 3 or 4 months before you're ready to retire. Get the ball rolling, get that paperwork done, and get it into Social Security, because it could take 60 to 90 days to process that paperwork.
Okay. Now, so let's shift over to all the supplements, right? It's like alphabet soup.
Yes.
Right. All the different letters. So what's the deal with those? What do those mean, or what are they for? And how do people kind of cipher through that?
All Medicare supplements are broken down by plan letter A through N. Generally, the most popular plans that people do, it used to be Plan F, but if you received Medicare prior to January 1st, 2020, you're not eligible for Plan F. Okay, but if you just had Part A before 2020, you're able Part A and B before 2020, you're eligible for Plan F. You'll always be eligible for Plan F from today going forward. If you receive Medicare after January 1st, 2020, Plan F is off the table. Now the most popular plans are Plan G and Plan N. Those are the most popular plans that I sell. But every plan is broken down by plan letter A through N. Okay. Plan F covers you for everything that Medicare doesn't cover. So generally speaking, Medicare pays about 80%. Plan F picks up to 20%. You have Plan F, you should have no medical bills. Okay. Plan G is almost exactly like Plan F. There's one difference. Plan G does not cover you for the Part B deductible, which in 2022 is $233. So the first $233 worth of Part B medical expenses you incur, that's on you. After that, you're covered just like you would be under Plan F. Plan N, which I think is a very good value plan, works almost the same as Plan G, whereas it has the Part B deductible of $233. The difference is with Plan N, once you reach your deductible of $233, when you go to the doctor, whether it's a regular, like a family doctor or a specialty doctor or specialist, you'll have up to a $20 copay. It could be less, but it'll be no more than $20. If you go to the emergency room, there'll be a $50 copay, but they waive it if you get admitted. And Plan N does not cover you for Part B excess charges. Now, that sounds like a really, really big thing. Potentially it could be, but it's a very rare occurrence. An excess charge means doctors could charge 15% if they don't accept Medicare assignment. 99% of doctors that accept Medicare assignment. So it's a really rare issue I've done a lot of Plan N's over the years. It's never reared its head. That doesn't mean it can't happen to you. It's just a very, very rare occurrence. Okay. But those are the three big plans where I believe you're afforded the most value. Okay.
All right. And I know they always talk about something where you have to enroll by a certain age, or there's some kind of penalty, or you get in trouble or something.
There's no penalty. The only penalties that incur under Medicare is if you don't apply for Part B when you're supposed to. Okay. So let's say you work for, or you're, let's say you go on Medicare and you're a veteran, for example, and you say, well, I go to the VA for all my care. I don't see any outside doctors. So I'm not going to pay Part B premium of $170. So these people, they opt out of Part B potentially. Big mistake, but they do it anyway, okay? Because they don't know any better. So they have just Part A only. So let's say they're 65, now they're 70, okay? 70, they want to go get a second opinion. They want to see doctors outside the VA. Well, they don't have Part B. They don't have that doctor's insurance. So they'll say, well, how do I get Part B? I'm like, well, you could get if you don't sign up for Part B when you're supposed to, between January 1st and March 31st of each year is the time to sign up for Part B. And that your Part B won't start till July 1st of that year. Okay. On top of that, they impose a penalty of 10% for every 12 months you went without Part B when you should have had it and you didn't have credible coverage. The VA is not considered credible coverage. So under that scenario, there's a 50% penalty put onto your Part B premium. That penalty will stay with you for the rest of your life. So right now it's $170 a month. The 50% penalty would be roughly $85. So for this year, you would pay $255. And that 50% penalty will stay with you for the rest of your life. That's one example of why there would be a penalty. The other penalty is for Part D prescription drug coverage. Okay. Well, unlike for Part B, where the VA is not credible coverage, if you get prescription drug coverage through the VA, that is deemed credible coverage. So let's use a different example for Part D. Let's say you go on Medicare and you say, you know something, I don't take any medicine. I don't want to pay for a drug plan. Great. It's not mandatory. You don't have to do it. 5 years down the road, you want to go get a drug plan. You can't sign up for a drug plan whenever you want. You can only sign up for a drug plan between October 15th and December 7th of each year. That's the Medicare open enrollment. Now there's special election periods, but let's just try to keep things simple. So during the open enrollment, you decide to get a drug plan. That drug plan won't start till January 1st. Let's say the drug plan is $10 a month that you sign up for. Well, they're going to impose a penalty for the 5 years that you didn't have credible drug coverage. Typically, the penalty is roughly 50 to 60 cents a month, or 1% of the national average cost of a drug plan monthly. And that every month that you didn't have a drug plan, for the sake of this example, it would probably be about $7 a year. So that drug plan that's $10 a month is going to be $10 plus the penalty, which would be roughly $35 a month. That penalty too will stay with you for as long as you have a drug coverage. Those are the only two times that you have the penalties are going to happen to you. Now, a lot of people think that if you don't sign up for a supplement, or you don't sign up for a Medicare Advantage plan in time, there's going to be penalties. That's not the case. You can sign up for a Medicare supplement 12 months a year. There's no enrollment penalties for Medicare supplements. Generally speaking, Medicare Advantage and prescription drug plans, you can sign up from October 15th to December 7th. If you're just getting Medicare, you can sign up for a drug plan and a Medicare Advantage plan. You have a 7-month window. So 3 months before you turn 60, 3 months before you start, well, when you get Medicare, when you turn 65, you have a 7-month window, 3 months before you turn 65, the month of, and 3 months after. So it doesn't matter what time of year you get that. When you age in, you could get this coverage whenever you want.
Okay. All right. So I like how you explained that. Thank you. Can you switch gears a little bit and talk about Advantage plans? You had mentioned them, but what do those aren't the same as the supplements? You have like Medicare Advantage. So what is different about those, or how are those utilized?
Well, you asked me at the very beginning of this podcast about the misconceptions, or a lot of people are confused about Medicare. So I speak to my own clients on the phone. I think I do a really good job of explaining. People call me on the phone and they say, Dave, I have a supplement through you. Or they'll call me up. They'll be a new customer or new client, and they'll call me up and say, I have a supplement. I go, who's your supplement with? Oh, it's with AARP. I go, how much is your monthly premium? $0. Well, I know that they have an Advantage plan because there's no Medicare supplements that are $0. Okay, so people think that, it's all melded together. Medicare Advantage plans are not supplements. So to answer your question, I got to tell you that, let me tell you what a supplement is and why it's different. With the Medicare supplement, you could see any doctor in the country that accepts Medicare. There's no network restrictions. If the doctor accepts that red, white, and blue Medicare card, they accept your supplement card. It's irrelevant who the company is. Okay. Advantage plans, on the other hand, are network-driven health plans. A Medicare Advantage plan is defined as a health plan option that's funded by Medicare, but administered by a private company. So the federal government is giving a private company of your choice a monthly premium, and that private company is administering your Medicare. It's a privatized Medicare health plan. These plans have to abide by the rules of Medicare. Unlike supplements that you can see any doctor in the country and there's no network restrictions, with Advantage plans, there are network restrictions. There's two types. There's two main types. I mean, there's actually three, but I'll only talk about two. There's HMOs and there's PPOs. With an HMO, you have to select a primary care doctor at the time that you apply, or the plan will assign you one. And that primary care doctor quarterbacks your care. Everything goes through your primary care doctor. You have to get referrals from your primary care doctor. With a PPO, referrals are not required. And you're covered, unlike an HMO where you're only covered in network unless it's an emergency or urgent care situation. With a PPO, you're covered both in and out of network. Out of network will cost you more, but you're still covered. So you have a lot more freedom and flexibility with the PPO than you do with an HMO. But any Medicare Advantage plan is not going to have a network the size of Medicare. Okay. I mean, Medicare, 97%, I believe that's the number, 97% of doctors across the country accept Medicare. That's not the case with an Advantage plan. So when people call me up and they're interested in Advantage, and a lot of people these days are, it could be the economy, people are trying to save money. Advantage plans, although they have no monthly premium for the most part, you have to make sure that their doctors accept it, and you have to make sure that their medicines are covered affordably. Advantage plans cover you for not only are the healthcare side of things, Part A and B, but they also cover you for Part D. And to make things even more confusing, Advantage plans are also referred to as Part C. So you talk about alphabet soup.
Yeah.
So that's the way that generally works.
Okay. And like most things with the government, it's never simple.
Yeah.
Okay. So how about employer provided retiree options? Are those most of the time Advantage plans? Like, you have a large employer, they have retiree health insurance. What do you see? And when you're working with people that have that stuff as a retiree, what do most of those plans fall under?
Well, there's group retirees like secondary insurance, where when you get Medicare and your group insurance will almost work like a supplement, almost like TRICARE for life, for the retired military. Mm-hmm. It'll work as secondary insurance. Typically, those plans will include drug coverage also. And there's group Medicare Advantage plans. What I see with group Medicare Advantage plans, unless people are getting it for zero premium, sometimes people are paying hundreds of dollars a month. Oftentimes there's no value there. One thing that you have to be careful of, though, even if you have a group Medicare Advantage plan, or even if your company is charging you a good amount for the secondary insurance through group retiree insurance, the first question I ask people when I speak to them is, I need to get a list of your medicine. And you might say, well, that's an odd question. Why do you ask them that? Because group health insurance will cover expensive medicine generally a lot more affordably than private Part D, okay, whether it's through an Advantage plan or through a standalone drug plan. So that is one thing that you have to be very careful of as an agent. As an inexperienced agent, you would never know that. You would say, well, you're spending $300 a month. I could get you into an Advantage plan for $0 or a Medicare supplement for $115. But the medicine is a big part, because if you take expensive medicine and you're paying $15 a month at the pharmacy, you could go on private Medicare Part D, and that could cost you several $1,000s a year. So, but that's basically what I see. Once again, people don't really have a big understanding of how their insurance works. So oftentimes what I suggest they to do, if they could get me a summary of benefits of what their current plan looks like, if what they have is better than what I offer, that's what I'm going to tell them to stick with what you have. If I could do something better for them, I'll tell them the reasons why, lay out the numbers, and then we can move forward potentially. And
I think this is a point of clarification there. You said it, and it's important, is even if you went with the employer provided one, the group coverage, it is a supplement to you still having to enroll in parts A and B. So that's your primary, and then this is a supplement too, correct?
Yeah. So if you, here, I'm glad you brought this up, because I just went through this the other day. When you retire, some people retire and are like, well, I have group health insurance through my employer. I don't need to carry Part B. In fact, you do. Once you stop working, you should get Part B. Right. And if you don't get it, you're going to be subject to the penalty. Mm-hmm. So there's two types of group health insurance plans for retirees. Secondary group health insurance that piggybacks off straight Medicare, or a group Medicare Advantage plan, which replaces Medicare just like a private Medicare Advantage plan would. These are Medicare replacement plans. So when you're with an Advantage plan, okay, you can put your red, white, and blue Medicare card in a safe spot, because your Medicare, for all intents and purposes, is going to be either that private Medicare Advantage plan you have or that group Medicare Advantage plan that you have. It takes over your Medicare.
Good. All right. I'm glad. I like how you said that. So without sharing any, personal confidential details about the client, can you give me a recent example of a situation where you really made a big difference for someone that you were working with? They were going down this certain road and they didn't realize they were going to make a big mistake, right? You kind of helped steer them in the right direction and made a big impact.
Well, I mean, generally speaking, like I just gave you the example before of the, there are people that move to this area because they're sick. They want to be near family. Their situation is maybe because they have some special circumstances to get into a Medicare supplement policy that I don't believe a lot of agents are knowledgeable of. I mean, maybe they are, but I don't see it very often, switching them into a supplement, which could be a very, very advantageous thing. I think the biggest thing that I do that separates me from other agents, because listen, we're all in business to make money. Okay. I mean, I like to help people and make money at the same time, but I have a family to feed just like everybody else. Where I save people the most amount of money, and is through the prescription drug coverage. Now, the prescription drug coverage is not a sexy product to sell. The commissions are very, very, very small. But that's where people waste the most amount of money. And a lot of agents don't focus on it because there's not really a lot of money. There's a lot more money selling supplements and advantage plans. But the drug coverage is where people waste a lot of money. I would venture to say by changing drug coverages year to year for either my existing clients or people that call me on the phone who want me to evaluate it through my website or however they hear of me, I would venture to say, if I had to guess, I save people annually at least $200,000 a year in drug costs, whereas they're saving that much money that they're able to spend on friends and family, vacations, going out to eat, than just wasting their money on a drug plan. Before I got on this podcast this morning, a gentleman that I work with, I helped out his aunt, his mother, sending me her information to evaluate. And I could tell that her drug plan that she's with is about $90 a month. And I said to him, how much medicine does your mom take? Oh, 2 low-cost generics. This lady is wasting $1,000 a year on premium, just a waste of money. No reason for her to be with this plan. But most people, they select a plan and they forget about it.
Right. They stick with it.
I tell people they have to evaluate their coverage every year. And I think that's what separates me from everybody else, is that even though it's not a sexy product and, you have to, I like to call myself the singles hitter of the insurance business, but it's a really important to my clients to evaluate their drug coverage because it's stuff that they don't want to do. And I do it for them, and it really cements my relationship with them.
Okay, great. So outside of your practice, David, can you share with me something that you're really passionate about personally?
Well, obviously, I'm passionate about my family, my son. I'm passionate about my golf game, which, considerably, I wish I was good at golf as I am at Medicare. I think I'd be a happier person. I'm sort of ashamed to say that. I mean, you see me play.
That's true.
But, I like to exercise. I like to be with my family, like to travel. I'm a pretty simple guy. I enjoy my business. I enjoy my work. So I like what I do. It gives me, gives me the time and flexibility to do the stuff that I enjoy. I've been able to watch my son grow up. I work from home the majority of the time. It's been a blessing. So I'm, good marriage. So I'm pretty happy.
Awesome. So from a business standpoint for you, what do you see as your biggest opportunity going forward in the future?
The biggest opportunity for me is I believe I have a good game plan, the way I conduct my business. I think that, my business continues to grow every year. I maintain my clients. I'm thinking about maybe, branching out to a different state or two, but just keep doing what I'm doing. I just, treat people right, treat people the way you want to be treated. I tell people I treat everybody like I'm talking to my mother or father, which sometimes people don't like because, like everybody, sometimes you get mad at your mother and father.
Yeah.
But,
right.
I try to keep things simple. Yeah, I don't do sales speak. I'm a straight shooting guy. I'm pragmatic. And I help people. And, like I said, it's been a win-win. It's been, I have a solid business, something I've worked very hard at. I've generated, all my business. I don't have any support. Everything's done through me. And just keep doing what I'm doing. It's a good formula.
Okay. And on the flip side of that, what do you see as some of your biggest challenges that you'd like to overcome in your business in order to take you to the next level or to get you to where you want to go quicker?
I don't think there's really necessarily any challenges. I mean, I think there's frustrations. The thing that you come up to when you're I'm in a position doing what I do that, like, when I speak to people and I invest time with people and I answer all their questions and I give them all their options, I think it's more frustration sometimes than anything else. I don't think there's challenges. There's extreme frustration sometimes because I'm in a unique position. When I work with somebody, I know what your best option is. Like, I know it because there's a finite number of options. Under Medicare Supplements, there's 25 or 30 different plans, drug plans, 22 different plans, advantage plans. Depending on the county that you live, there's 30 or 40 different plans. I ask all the right questions. I know what your needs are. I know what your medicines are. I know who your doctors are. I know whether if you want to deal with referrals or not. So when I don't get the business, I find it very frustrating because I give all the answers. And if I could somehow overcome that, it would definitely make me happier because that's something that I've never been able to get my arms around because, if if you sell life insurance or annuities or car insurance, there's a zillion options that you could sell people. What I do is that, like I said, there's a finite number of options. So like, for example, what a lot of people don't realize under Medicare supplement coverage, all Medicare supplements are standardized coverages based on plan letter in Florida in 47 out of the 50 states. So if you want to go with a Plan F in Florida, every company that offers a Plan F offers the same exact coverage. The only difference is the monthly premium. So I put people in the lowest cost Plan F. By paying more, all you're doing is wasting your money. So if people don't trust me on that, when I'm giving them all the proof, it's a frustration. Sometimes people go do it themselves, which they receive no benefit from. Okay, but they're not going to get it any less expensive if they go direct or go through me. So, but not to go on much further than that. I don't think there's hurdles that I have to overcome. There's frustrations that I have to get better at dealing with.
All right. Now, if people wanted to learn more about you or contact you, what do you want to tell us is the best way to do that?
I'm sort of old school. I always love the phone call. So you could reach me on there's two separate numbers, 941-907-2879. That's my local office number. You can reach me on my mobile at 813-417-2716. You can also go to my website. You could go to davesilverinsurance.com or medicaredavid.com. It's going to get you to this. It's going to get you to the same spot. You could reach me at info@davesilverinsurance.com, or you could reach me at medicaredave.com.
All right. So let's try to get everyone to go to the Medicare Dave or the Medicare David. Those are the easy ones to remember. That's good. I like it. Okay. David, listen, I want to thank you for taking the time to be here with me today. It's been a real pleasure. Very informative. Went through a lot of information, learned a lot. And I want to thank everybody for tuning in and watching the Confident Retirement Podcast brought to you by LPF Advisors, where we are raising the retirement confidence of everyday people one show at a time. Thanks, everybody, for tuning in. Have a great week. We'll see you next time. Thanks for listening and watching. Be well. Take care.
Thank you, Kris.
You've been listening to the Confident Retirement Podcast with Kris and Mark from LPF Advisors. For more information on them and retiring confidently, please visit lpfadvisors.com. If your ears are pleased and your mind is now at ease, do share the program with your friends and subscribe wherever podcasts are found.